Okay. So can everyone hear us? My name is Yona, and Adeen and I are going to be talking a bit together about a project that we're doing. And we have just a few slides, but we'll try to tell the story of why we're doing this project and a few things we're learning. And I'll just talk while the slides come up. So, we're doing a study, a project. It's called Brain Health for All. And it's focused on people who have developmental disabilities as they get older, as well as their families. And it's a cross-Canada project, and we're really quite excited about it. Here's a beautiful illustration that was actually created by one of the people involved in our program. So when we talk about for all, we're really emphasizing how we work in partnership together with people with lived experience of having a developmental disability as well as with their families. And we sort of thought, well, what does brain health actually mean? And we got together and we spoke about what it meant. And it's a beautiful illustration that Judy was actually doing while we were having our Zoom meeting. So we had all these different people giving their ideas about what brain health meant to them. And this is what Judy created. I guess I just want to say that even if you don't know someone with a developmental disability in your life, you may be someone with an experience of not just thinking about things like dementia or brain health, but thinking about other things that might be going on in your life that also might make you feel like you're at greater risk. And that's certainly the case for people with disabilities. So in our program, what we're doing is we're teaching people with developmental disabilities and families and service providers who work in health and in social services how we all can improve our brain health. So if we go to the next slide, we really wanted to highlight here that sort of all teach, all learn philosophy. And I think we're seeing a little bit of evidence of that today. I know we had some really important words from a daughter of someone who had dementia, and then also listening to the important story that we heard just before. In our program, these are some of the people who are thinking about what brain health means. And we don't have to identify each person in terms of what their role was, but we recognize that to figure out what we're going to teach, we have to talk to the people who are having those experiences themselves. And we have to be really gentle about how we do that, trauma-informed and thinking about these are not easy things to talk about. And sometimes the resources we have, they just don't land well. So we have to work together with people to figure out how do we adapt them to the people that we're working with. So Adeen, I know you have some thoughts on that as well.
Thanks so much, Yona. And one of the first questions we were asked as a team is what brain health means to us. And it's a really good question to think of, and it's everything. And as an aging care partner, my ability to advocate for and with my son is totally dependent on my brain health. My physical and my mental flexibility all rely on my brain health. And even though my son and I are both very much impacted by the social determinants of health, our resilience and our ability to deal with these determinants and to go ahead and progress in our lives and find meaning and to really make valuable contributions in life all depends on our brain health. And at work here at CAMH, where I work for Yona, mental health is health. You'll see that everywhere here. Well, brain health is health. And I think we're moving on to the next slide now.
Okay. So I'm going to talk now a little bit about the blurring of the roles and the multiple kind of hats that we wear sometimes. So you see here the three different groups that we're targeting in our intervention. So self-advocates is the word we use for people with developmental disabilities who are in our program, and families, and of course service providers. But it's sometimes not so neat where we're just one of those things. So I'm a scientist and I'm a clinician, and that's the role I play in the program. But I'm also a sibling of someone who has a developmental disability. We have another clinician in our team whose father, maybe recently had a diagnosis of dementia, and they're figuring out what that means and what that's going to be. But also the people with disabilities, the people we're thinking of as the patients, they have family members in their life who they're, scared about and trying to understand who might have dementia. So we're often kind of working together. We don't just wear one hat. And I think that's a really important thing to think about in the programs that we do.
Yeah, that is such an important component. And speaking, I'm obviously going to be speaking about the context of care partners, as that's what I am. And I'd like to bring what we can bring as care partners to teams, to agencies, to clinicians, to organizations. And we are the constant in our loved ones' lives. We're the liaison between all of the agencies, the practitioners. Sometimes we're an administrator, sometimes we're a personal assistant, a friend, an advocate, an interpreter, an entertainer. We organize things. And looking from a clinical perspective, in a direct observation, you get a snapshot, don't you? You get that moment in time. Same thing with agencies. You see the client where they are at that very moment. As a caregiver, we have their story. We know their context. And without that knowledge of the backstory, I'm wondering if you can really give a true trauma-informed practice without really knowing it. You can guess, you can use your intuition, but I think this is where we can rely on care partners to give that story, providing the relevant data. We can then share the prologue, the antecedents, and the full history that underlies the person. And now looking at what care partners get out of this process, speaking personally, when we're part of the circle of care, we feel validated. When we feel validated, our loved ones also feel validated. We're so interconnected. And ideally, the other thing that we get is we see the humanity of the clinician. We see the humanity of the agency. And speaking personally, it means so much to me when I see vulnerability, when I see the humanity, and I see that the people that are loving or caring for my loved one have as much of a vested interest as I have, that they really care, they want things to work. And now I just want to look at one other aspect of the care partner, and that is in peer support. And we owe so much to Yona and the Azrieli team really for providing wonderful opportunities for peer support workers. And many of us that have been navigating a journey supporting an adult who is neurodivergent for a long time have lost trust in the system. Sadly, many of us believe that the system has let us down, that professionals have let us down, that the experts maybe have let us down, and trust is gone over a long time. But in partnering with caregivers, a lot of other caregivers feel a sense of trust. They feel a shared experience. And I think that that in itself necessitates a need for care partners working together as in peer support, as teachers, as mentors, as part of lived experience. And it authenticates our experience together, and many other care partners feel safer with this shared experience and might perceive us as a parallel colleague. And from a systemic model of leadership, lived experience partners within an organization, we could be considered servant leaders. And just picking up on my drop papers, I'm a bit spatially challenged. So in a sense, I'm just throw my stuff all over the place. This is what I do when I'm on stage as well. I'm sad as a performer. So we are leaders together. It's servant leadership. It's not that kind of demographic pyramid of the top down. So I will hand over to Yona now about multiple roles.
Yeah, I'm going to go right to the end, I think, just to talk about one last point, and then we're going to wrap up. So we could talk about this for a long time, but we won't. So the flyers are a bit ahead. This is just showing all the people on our team. If we go back for 1 second, I know people saw that slide before about the emergency tool. Just want to make one point about that. When we talked about that, we said this is a tool for the patient, right? This is for the person with a developmental disability, if they're aging, if things are going wrong and they need help. And a family member said, what about the tool for me? And it made us think, what about tools that people need to have together right? Again, thinking about a team, what are our plans? How are we preparing? And how are we working together in terms of how it's not just one person who needs help, right? And having those dialogues and thinking about new resources where people can come together is really important.
So I'd like to share with you actually right now a personal experience, and this is about blurred roles. And my son has given me permission to share that he's in hospital at the moment following a psychiatric emergency. I was allowed to be with him during the emergency process, and I was there as his microphone as opposed to being his voice. I was his interpreter, his advocate, his comforter. And when he settled into his unit, one of the first things that he said to me is, "Mom, I hope you don't get dementia." And even thinking about that now really brings tears to my eyes, because he's desperately afraid of what's going to happen, what will happen for him, as much as he's very valued with the people that he lives with and the people that support him. It's quite frightening to think about. And there's a blurring of roles. This is a huge element, and there's also a blurring of roles right now, for instance, I'm hearing impaired, and this room is an absolute nightmare for me. So I can't actually hear conversations, even with my hearing aids at the moment. When we go out, my son's my interpreter, and he is speech impaired, and what he does is he will often text on his phone what a salesperson has just said to me, and I will then tell him the answer, and he'll text it back, and it takes a really long-winded thing, and we support each other, and this is part of my own aging process, and my hearing is getting worse and worse as I age. Now, at the moment, dementia is not a factor, but looking at the trajectory of his life as one that is bipolar, one that is autistic, looking at my own trajectory of clinical depression. This is frightening. It's a really frightening place to be. And our roles blur. And I just wanted you to be aware, really, to be sensitized and aware of how these roles can overlap with each other. Yeah.
Thank you for sharing, Adeen. We are going to wrap up. We will have information about our program outside, but I think our last message is that we're all actually very layered, complicated people with lots of things going on, and we need each other, and we need to be supporting each other. And partnerships, seeing that humanity, and also the different roles of the clinicians, the providers, the researchers, and the people with experience is really important. So thank you.
Thank you.